ab shish kebab, and tirofiban, the tire viper, are drugs within the class known as glycoprotein, GP, 2B3A inhibitors. In this picmonic, we use tire viper to represent tirofiban because this drug is derived from snake venom. Another drug of this class, which is not seen in this picmonic, is eptifibatide. All of these drugs are considered to be 2B3A receptor inhibitors, portrayed by the 222B and 3 tree apples with inhibiting chains. By inhibiting platelet glycoprotein, or GP2B3A receptors, the binding of fibrinogen is prevented. By preventing binding of fibrinogen, these medications inhibit platelet aggregation, shown by the plates with inhibiting chains. This is useful for prevention of thrombotic events, represented by the trombone event being prevented by the smell of the ab shish kebab. This is often indicated in patients with acute coronary syndrome, or ACS, illustrated as the acute angle heart, as well as patients undergoing percutaneous coronary interventions, shown by the heart with coronary stent. The major side effect associated with these medications is bleeding, especially gastrointestinal hemorrhage. Bleeding is shown by the bleeding guests crying blood at this wedding. Considerations to keep in mind is that these drugs are quite expensive, shown by the expensive gifts. They can cost upwards of $1,000 for a single course of treatment. Lastly, glycoprotein GP2B3A inhibitors are often administered to patients in combination with other medications such as heparin and aspirin. Here, we depict combination drug therapy as the combination of med bottles. So let's review abciximab and tirofiban. These drugs are glycoprotein GP2B3A receptor inhibitors that work by inhibiting platelet aggregation. This is helpful in the prevention of thrombotic events in patients with acute coronary syndrome or after a percutaneous coronary intervention. The major side effect associated with these medications is bleeding, especially gastrointestinal hemorrhage. These medications are expensive and are often administered to patients in combination with other medications such as heparin and aspirin.
Picture abciximab and tirofiban with this nasty ab shish kebab being cooked up by the tire viper. We use a tire viper because tirofiban is derived from snake venom. In this scene, the tire viper cooks up ab shish kebabs to cater a wedding. This is because these drugs affect platelets, the plates used to serve ab shish kebab, and are used to prevent thrombotic events in the heart. The band of trombones playing at this wedding for two hearts deeply in love. These drugs inhibit 2B and 3A receptors, so imagine this tire viper using the honey from a 22B to flavor his abs, while the branches from a 3 apple tree are used for the fire, 2B, 3A. When the abs are ready, it's time to put them on a plate, but even the plates don't want to go anywhere near this dish, so they have to be separated and held down with inhibiting chains. So on to the indications, starting with thrombotic event precaution, where the band of trombones hired for this wedding are too sickened by the smell of cooking abs to play. So the trombone event for this wedding of two hearts is prevented. One is an acute angle heart for acute coronary syndrome. Just imagine him like the groom, opening the acute angle like a case for a wedding ring. And the bride is holding out a coronary artery for him to put a ring on, except instead of a ring, he places a stent inside of her vessel. This is to represent percutaneous coronary interventions. Not surprisingly, a side effect of inhibiting platelet aggregation is bleeding, and it can be seen in those who came to see the wedding crying bloody tears of joy. They're so happy for the newlyweds, they shower them with expensive gifts and envelopes full of money, like most weddings, because you need to remember that these drugs are expensive, like weddings. And sitting on top of the wedding cake, we show 2 med bottles being combined in holy matrimony, because these drugs are often used in combination with other drugs, such as heparin and aspirin.